Very good evening to all of you. On behalf of Sri Lanka Medical Association, I welcome everyone, the resource persons, and those who are representing the Sri Lanka Medical Association, and also the resource persons from Mobitel as well as from Suasaria and from the Ministry of Health for this very important event. This training program for medical doctors to provide health education and the medical advices for the COVID-19 patients. If you may remember that in 2020, we had a similar program in collaboration with Mobitel, which was successfully implemented. So during this time period also, we felt there's a timely need and something that patients really need during this crisis situation. So that's why we want to start this program, and today we are going to have a training program to provide you a brief overview on what is expected. And I would like to invite my co-moderator, Dr. Ruwais Hanifa, who is also past president of SLMA, to tell few words of why we wanted to have this and why you are going to have this training program. Over to you guys.
Thank you, Indika. I think most of you know the statistics and what phase we are going through at the moment. To describe this as a catastrophe will be an understatement. And as a medical community and as a Sri Lanka Medical Association and its members, we have to have a role to play in bringing some sort of relief, at least reassurance to our patients who will need our help during this time. So I am absolutely shocked. I think that's the word I use by the number of volunteers who has joined this program to provide relief to our patients in this country. So I think Professor Indika is a veteran in this business. During his presidency, when COVID hit us, he took the initiative and started a similar program at that time. But you will see that the circumstances and the management approach to this program will be different. So I must thank the current president of the Sri Lanka Medical Association, Dr. Padma Gunaratne, for giving her permission to conduct this program at this hour of need, because the Sri Lanka Medical Association has to play a role. And we thank her and the council for giving us their blessings to start this program, even with a little delay. We should have done this a little more, but we had to work through some systems like any other organization to get consensus and move on. So I think we have achieved that. That's behind us. So let's move forward. And may I just conclude by telling you that this is not about treatment itself, it's about care. Caring for people at a time like this as medical professionals and doctors is very important. Part of that care may be treatment. So that's what Indika and his team of doctors and very experienced non-medical personnel from Suasaria and Mobitel are here to guide us through this and to give the best possible service to the callers to the Mobitel line, which will be launching very, very soon. So without further ado, I hand back, and let me also thank all the resource persons, my teachers and so on here, but there won't be a formal vote of. So on behalf of the SLMA, I thank all in my committee and Indika for taking the lead and actually pushing this. And I use the word pushing in capital spellings because he put a lot of effort into where we are today. So over to you, Indika, and thank all of you and all the participants. Now it's 152 for your very, very, very enthusiastic participation in this program. And I have absolutely no doubt that the patients will benefit from this. Thank you, and over to you, Indika.
Thank you, Dr. Hanifa, for this very encouraging words. So we'll straight away move to the training program and what do we expect from this training program. Basically, you should be able to conduct a rapid remote assessment and provide health education, the necessary health education for the patients, and identify red flags and whenever necessary to refer them, and then direct for appropriate care and support. So those are the outcomes that we are expecting during this training program. Okay, so Why this was needed? I think Dr. Hanifa very clearly mentioned that as a response to current crisis, this is the need of the hour and this is our responsibility. And we had a similar experience of a program that was successfully conducted in 2020. And one thing we have to mention is this will complement existing platforms, because we are aware that there are several other platforms that are conducted by Ministry of Health, so on and so forth. For example, the home-based management program and different helplines. So basically, this will be complementing the existing platforms and working together with them, because at the moment we have to work together because all the systems are overloaded. That is why we call this a crisis situation where no one system can cater for the demand. So that's why we have to work together, and that's why the SLM has also decided to come forward. And the information about the process and the platform will be provided by Mobitel with their experience regarding the technical details. But basically, essentially, this platform that is managed by Mobitel, and it's a completely voluntary program. There will not be any charging from anyone, from the users or anyone. And the service providers or the doctors, you can basically provide your service voluntarily through an opt-in and opt-out mechanism. This means that you will not be getting calls all the time. You can decide when are you going to get the calls, and we'll be providing you what are the information that are available and the resources and support. For example, we have established very strong collaboration with SUAS area and also with the Ministry of Health, and also probably how to handle difficult situations. And then moving on a little bit about the basic facts, because there are a lot of junior doctors who are joining with us today, and the current status of epidemic also. And there may be some questions that are related to vaccination, because there are a lot of people who want to know about vaccination, and there are frequently asked questions also. We discuss a bit about that as well. And then regarding the remote assessment, the basic assessment like the symptoms, the day of illness, and the simple symptoms that we are having, so on and so forth, those areas, and very importantly, how to identify the red flags. Okay? And those areas again will be discussed by another eminent resource person. We are having several resource persons today. One Mahendra Ekanayaka, so he will be discussing those areas with us. And related to the epidemic aspect, Professor Manoj Veerasinghe will be providing information. And then how to assess long-term complications, and then after that, what kind of advice we need to give, like what to do and what not to do, like the bed rest, hydration, nutrition, and what they should not be doing, like in SAID, so sharing personal items. So those areas will also be discussed during this session. And then how you can guide them to support. What are the different available support available, like SUAS area, how can we connect with them? Okay, and advice regarding transport and probably follow-up. Okay, so those are the areas that we'll be discussing initially. I'll be providing a very brief overview, very basic overview. This will be very basic for most of you, but considering that there are several junior doctors and also our expert panel will be expanding on those areas, is very good. As you are well aware, the coronavirus is the kind of colloquial name. It's a RNA virus, and the scientific name that we are using is SARS-CoV-2, because previously also there was SARS virus, and since it's a coronavirus and this is a second one related to SARS, it is scientifically called SARS-CoV-2, and the disease, the WHO terminology, we call it COVID-19, because initially it was identified in 2019. And if you go into the structure, you can identify this the RNA molecule, the genetic material, and also there is a lipoprotein bilayer and those spiky proteins. So those are things that would be very important for us to understand the behavior of this virus. For example, this being our RNA virus, we know that when it comes to the same maybe replication, it very much differs from DNA virus replication. It doesn't have the checks and balances of the DNA virus replication. That is why the RNA viruses are very frequently mutated, and that's the reason for the variants that is we are talking very much about today. and also this lipoprotein bilayer, which explains the preventive measures like washing with maybe soap or maybe alcohol, and which will destroy or disintegrate the virus. And also we are talking a lot about this spiky protein, which can go and basically attach to the cells. And as we are well aware, the viruses cannot replicate outside cells, and we know that generally they bind to this ACE2 receptor, mainly in the upper respiratory tract, and they enter the cell, and then the RNA is released and the replication process happens, and then the translation and packaging. So more and more viruses are replicated and released within the upper respiratory tract, and then it goes down the respiratory tract and the pathophysiological process starts. And the general timeline after infection, the general incubation period ranging from 2 days to 2 weeks generally, but nowadays Sri Lanka apparently it has become much shorter, around 5 days or even less with the new variant probably. And then viral replication and the genome is increasing, and as time goes on, initially mild illness and later maybe severe illness, and later as the viral load goes down, then the antibody production starts. And when we talk about vaccines, generally the concept of herd immunity also comes into play, and again all of us are aware the concept of herd immunity, where generally about over 90% of the population is basically having the immunity, then you can basically break this chain of transmission. So that's a simple definition of herd immunity. However, if a disease is spreading very fast, then the amount of immunity that need to achieve herd immunity is very high, at the moment around 95% or even more, and currently are not anywhere near that. And the basics of vaccination, the basic is you basically inject the antigen, and it triggers off the immune response and the immune memory in the body. And so, and time goes on, it goes down, and that's why you need a second booster dose also. And how different vaccines work very basically, very quickly, but how all these vaccines work is they basically train the immune system of our body. So when the next time when the virus comes up, the immune system is trained to identify and attack it. And what happens in Oxford AstraZeneca is, or the Covishield, is that the gene or the DNA material that can produce the spike proteins are inserted into a harmless adenovirus and then injected into the body, and within the body the DNA is released and it produces a spike protein, and that triggers off the immune response within the body. Okay, and then if you take the Moderna vaccine, what happens is the RNA that is responsible for providing the spike protein is coated in a nanoparticle and inserted in the human cell, and then the immune response started, and the immune mechanism and the memory. And if you take the Sinopharm and Sinovac, then the mechanism is different. What happens there is the inactivated dead virus is inserted. So there are many antigens coming into the body, and then the immune response triggering off. So there's a bit of comparison which all of us are aware how many doses and the efficacy and storage. We are very much aware of all these things. Yeah, a little bit one word about the efficacy. There, one thing we need to remember is that you can't compare efficacy of one vaccine with another one, because this efficacy is measured in different ways. And yeah, because another thing we need to remember is what is meant by efficacy. Say 90% efficacy doesn't mean 10% get the infection. What is meant by efficacy is compared to those who haven't got the vaccine, those who have got the vaccine have say 90% of less chance. So it's a risk reduction. 90% less chance of getting severe illness or mortality. So that's the definition. So I think we need to keep these simple things also in mind. And yeah, finally, regarding, we are very much away from herd immunity. I think currently, our priority should be basically reduction of the deaths, because there are so many patients who need adequate medical care and advice, and still the current surge and the number of amount of complications will come maybe few weeks later. So before that, we need to try our best and prevent that.